Good morning, ladies and gentlemen. My name is Felix Jese and I'm from SMA in Satu Klaten. Many would say that it is very unfortunate to have this kind of condition, this COVID-19 pandemic. Indeed, we've been facing challenges because of this COVID-19 in every life sector, like economy, social, education, and of course health. We've been forced to change, to deal with this situation, and nobody was ready. At the beginning, every action taken was an emergency action. People were panicked and they didn't know what to do. So all these things concerning to COVID-19 were new and unknown. But I always believe the old saying, every cloud has a silver lining. In everything which looks bad, something good is hidden. To quote the author, Paulo Coelho, an arrow can only be shot by pulling it backward. So, when life is dragging you back with difficulties, it means that it's going to launch you into something great. Hadn't we better have hopes and spirit that with this COVID-19 pandemic, we will be better in anything? Take education as an example. Don't we have the new curriculum which had been longed for, which is more compact and flexible without leaving the important points? Wouldn't we have the same for the health sector? Could we believe that this COVID-19 pandemic will move us forward into the better healthcare system, which is more affordable and equitable for all? I do believe that. I'm from Klaten, and do you know that according to coronajatengprof.go.id, in Central Java, there are almost 18,000 people who are infected with coronavirus, and those who are cured are around 12,600. Cured here means that they can do all their normal activities. The death rate, according to the same source, is around 1,500 people, which is less than 10%. Of course, this is not a piece of good news that people are losing their lives, but there is something positive happening. The number of those who are cured is increasing and the death rate is decreasing day by day. At least this is what happened in Central Java. This is possible because the government and the medical officers traced the suspects of COVID-19 and treat infected patients at the hospital well. They also do their best with the government support like PPE, ventilators, masks, etc. so the patients can be cured in a short time. Before COVID-19, we had big problems in our healthcare system. First was there was not enough equipment, and second, those with less money couldn't go to the hospital and enjoy the luxury of being treated by the specialists. But during this pandemic, the condition had changed, or forced to change. People will get the same treatment once they are suspected to have the COVID-19. They are treated by the same doctors using the same equipment. There are no ventilators for the poor or the rich. They're all the same, and people have the same goal, to save life and to be cured from this disease. Human life is valued more than ever. As examples stated above, tremendous supports come from everywhere. What is the underlying spirit for all these supports? Care. If we keep this flame, I do believe that we will manage to have more equitable and affordable healthcare system after the COVID-19 pandemic. In unity, we can. Fixing all the factors that contribute to health inequities, as what we have in Indonesia, is not a simple matter. But indeed, the COVID-19 experience has highlighted some ways that we can do to rebalance the healthcare system. The essence of equitable and affordable healthcare system is integrating from medical with non-medical services. It is like what is happening at this moment during the pandemic. The paramedics are doing their jobs in the hospitals, taking care of those who are infected. The media is trying to spread knowledge about the precaution and what to do during this pandemic. The haves donate their money to purchase health equipment to fulfill what is lack in the hospitals, and the ordinary people can also contribute as well by following the health protocols. If something bad happened, don't make it worse. It's not too much to say that during this pandemic, the time of disaster, the bad condition, makes the nation unite. People forget their differences and fight against the same enemy, COVID-19 virus. The effort of ushering towards equitable and affordable healthcare system after the COVID-19 pandemic has been started here and now by the people and the government together. The first step is improving the health care access. That is what we are doing right now. A strong foundation has been built. Everyone can access to the health care during the pandemic, no matter what the social or financial status is. They have the right to have the health service, to be attended by the doctor or the specialists. People can even consult a doctor about their symptoms online. Many things have been done to make it easier for people to access healthcare. We've been built a great teamwork during this pandemic, so it is not a choice to stop if the pandemic is over. We've seen volunteers work together hand in hand, building a healthcare system which can be accessed by all. It is a giant step for us. It also reflects our healthcare system future. Let's have a great hope that in the near future, Indonesia will have an equitable and affordable healthcare system. Thank you.